Welcome to Environmental Concerns, sponsored by Breathe California, which is the lung health nonprofit for California, trying to protect you from damages to your lungs from air pollution, smoking, and other such things. We'll be talking with Sharmin Sultana about health issues related to protecting your body from damage in about 30 seconds. So come on back and we'll be discussing various different diseases. Breathe California works with people in the state to try to reduce about 13 different lung related health problems. So we'll be with Sharmin in about 30 seconds.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. This is Environmental Concerns, sponsored by Breathe California. I'm a volunteer. If you want to help us out or just learn something about your lung health, go to the website under my name, lungsrus.org. Or if you want to volunteer or have a question, call us at 408-998-5865. Sharmin, welcome to the show.
Thank you so much, Teddy. I'm truly to be honored here today. Yeah.
So what do you do for Breathe California?
So I serve as the Director of Senior Health Services at Breathe California. We collaborate with the community partners such as senior centers, community centers, and libraries throughout the Bay Area to provide educational presentations on lung health that covering disease prevention, treatment options, and overall wellness for seniors. We also offer breathing exercise yoga that is very popular among the older adults. In addition, we educate seniors about the various lung disease. Moreover, we conduct health screenings such as in the senior centers, including blood pressure checks, oxygen saturation measurements, and lung health assessments. In addition, we provide indoor air quality assessments and fall risk prevention services for individuals who have asthma, allergies, or any other lung conditions. We actively engage communities through the health fairs, connecting people with resource fairs, and that promote actually clean air and healthy lifestyle.
So one of my favorite subjects, you mentioned indoor air quality, which is, as a general rule, the air quality is better outside than inside. You've got cooking and heating, use of cleaning substances inside your house, and they're not getting aired out very well. Is that pretty much a good way to describe indoor air quality?
Yes. For the indoor air quality assessment, actually, sometimes people doesn't know that sometimes for the heating, cooking, and there sometimes they have the old house they have the mold in the wall or in the old carpet. There's a lot of dust over there. So for those reasons, the air quality inside the home is sometimes bad. So we have a air quality detector. That is a machine that we go to the senior's home and we measure the air quality at home. And then if the comparing to the air quality, then we just like educate them like how to improve the air quality at the home. We like some in Breathe California, if the seniors qualified, then we actually offer like air purifier for them, which is totally free. So yeah, that is the one thing that like if you like run air purifier for the 24/7 times, so that like your air quality in the home is will be improved.
You're a medical doctor. Why don't you talk a little bit about how you ended up here in the United States working for Breathe California?
Well, yes, my background is in medicine. I'm a physician and I completed medical school in Bangladesh and worked at a hospital over there before moving into the United States with my family. And I have always been passionate about public health because I believe prevention is the best policy. And after relocating here, I earned master's in public health from the University of Nevada, Reno. And during my graduate program, I interned at Breathe California. And following my internship, I was hired into this current role.
Well, internships are at Breathe California are a great way to develop work experience and credibility for the marketplace. I probably had 30 of my students from San Jose State or Santa Clara
Yes,
um, work there, one of which became manager of the energy program.
yes,
And you're a prized example of how it can work out, having started as an intern. And we are lucky to have a medical doctor in your role.
yes.
So I'm a senior. Why are you specializing in senior services?
Mhm. Yes. So in the like in the seniors, actually, we that we say that like we provide like breathing exercise, yoga, then like lung presentations about like senior center, like community centers and libraries over everywhere in the Bay Area. We provide lung presentations, and those presentations covered like disease prevention, treatment options, and overall wellness for the seniors. And along with that, this year we are doing for the seniors, we are doing like we are celebrating World COPD Day, which is for the seniors because a lot of in USA, in a lot of seniors and older adults, they are like they have this COPD for a long time, and that's why we are really think about this World COPD Day to celebrate for them. And we are proud that like every year we are doing that, this World COPD Day. So I just wanted to talk about these things because we are really excited to celebrate this World COPD Day this year. And this year, Santa Clara Family Health Plan is sponsoring us for this event, and we'll be celebrate on this November 19, Wednesday, from 11:30 a.m. to 1:30 p.m. So I hope everyone will join over there.
So you mentioned your husband works as an engineer, but I also know you've described him as a professional hiker. What does that mean? How do you be a professional hiker?
Okay, so yeah, so my husband is a professional hiker, so like and his passion actually inspired me to get involved for this my new hobby. So I'm not a professional hiker, but I like to hike. Yeah, it is recently developed in my hobby, and also I like to swim too. That I recently learned. Yeah.
Well, I am heavier as a senior than I would like to be. And probably one of the things I could do is a better job of walking every day. I probably only do it about a couple of days a week. But I gather that's important to your health.
Yes, I think yeah, walking is a really good exercise for your age right now. Yeah, you can do a little exercise, not heavy exercise, a little bit hands-free exercise you can do along with walking.
Breathe California has literature in many languages on 13 different lung disorders. So anybody that wants to learn something ought to call in or drop by the office. One of the ones we particularly wanted to talk about today is COPD. What do those initials stand for?
Yeah, COPD stands for chronic obstructive pulmonary disease. It is a chronic long-term illness that makes it hard to breathe. It is sadly that 16 million adults in the US have been diagnosed in COPD currently, and it is the fourth leading cause of death in the United States, which is killing more than 120,000 individuals every year, which means one death in every 4 minutes. So in COPD, it actually has two main problems. That one is the emphysema, and another one is chronic bronchitis. So if you think about your lung, that your lung has air tubes and air sacs, and those air tubes and air sacs in COPD, those are getting actually involved. The air tubes are getting swollen and thickened in COPD, and the air sacs are getting damaged, and then this makes it harder for air to move in and out. So breathing is really difficult for people who are living with COPD. And the main cause of the COPD is smoking. Smoking is the biggest cause, and other causes are like a polluted air, dust, or chemical fumes at work can also lead to COPD. If you think about the symptoms are it's like chronic cough, person feeling shortness of breath, especially when moving around, and then sometimes cough comes with mucus, and you feel wheezing, that is like a whistling sound from your when you breathe that time, and feeling tightness in the chest.
So I'm a volunteer for Breathe California. Why don't you, as a full timer, talk a little bit about what Breathe California does?
Yes, the Breathe California is like a 114-year-old local non-profit that fights lung disease in all its forms and work with its communities to promote lung health. We serve all 8 counties around the Bay Area, from San Francisco to Contra Costa to Santa Clara County and Santa Cruz to Monterey counties. This organization runs a variety of local programs to advocate for key clean air and public health policies, provide information on COVID and other serious lung disease such as COPD, prevent teens from using tobacco and vaping, teach kids how to manage their asthma, and then distribute CPAP machines and other breathing equipments. We also support innovative research. Also, we do assist smokers who want to quit smoking, and prepare communities for lung health energies such as wildfires.
So I want to put in a plug for one of the things I worked on recently. Uh, Beaches in California, 95% of the litter laying around on them is cigarette filters. And I and any number of others appeared before the Santa Cruz County Board of Supervisors and got them to ban cigarette filters. So you can still buy a cigarette in this county, but it's illegal to put one of those filters on, which are a health disaster,
Yes,
uh, particularly for animals that live in the ocean, but also just making our beaches uglier than they need to be. So
yes,
you wanted to talk about World COPD Day. So I
yeah.
gather it's a problem anywhere in the world, not just here in the US.
Yes, it is like not in the US. Like like every year when we celebrate COPD, it is like a lot of people actually from all over the world join us in the COPD day to listen our webinar.
So we've been talking with Sharmin Sultana, who's the Senior Services Director for Breathe California. We'll be back to talk with her about some other interesting things that affect your health in 30 seconds. So stick with us.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today.
Welcome back. We're talking with Sharmin Sultana, Senior Services Director for Breathe California. She mentioned that they cover much of Northern California except for the Central Valley. So everything that we say is going to be relevant to protecting your health. Why do you think we have a World COPD Day? You mentioned it's global initiative that tries to improve COPD care.
Yes, yeah. So the thing is that our message is very clear. It is we want to improve COPD care worldwide, and our message is that like early diagnosis and treatment of the COPD. So which often involves medication and lifestyle changes like smoking, quitting smoking can significantly slow the progression of the disease and improve the quality of life.
When is the World COPD Day?
The World CPD Day is in November 19, Wednesday from 11:30 a.m. to 1:30 p.m. on Zoom. So we will send you the Zoom link very soon.
And why is Breathe California sponsoring it?
So the Breathe California is a like the because we are non-profit organization and we work to protect lung health and fight lung disease like COPD, asthma, and lung cancer. And we always care about clean air and stopping tobacco use. So by sponsoring and organizing World COPD Day event, Breathe California is actively teaching people about COPD symptoms, risk factors, and the importance of early diagnosis. Also, by supporting patients and families living with COPD, advocating for cleaner air and breathe better policies to directly prevent new cases of COPD.
So November 19th, this event is via Zoom and it's free.
It is totally free. Yes, it is totally free. We will have keynote speakers, and also we will talk about COPD and the new treatment options. We'll have the respiratory therapist on that day who will share tips how to change your lifestyle while living with COPD, and we'll also have a yoga instructor who will lead breathing exercise to help you breathe better and feel good. Yeah, and a group of students from the San Jose State University will help organize and run this event.
Well, that sounds great.
Yes.
Um, I notice my notes say there are prizes. How do you win a prize at this
Oh
event?
yes. So there will be like we'll also play the fun bingo game over there, and winners will get the prizes. And there will also be like door prizes. Some lucky audience members will win.
So this is all important. Can you mention some of the other things that Breathe California does to protect our lung health?
Yes, over the last few years, actually, we have been very busy. We have worked on tobacco prevention laws in many cities, educated people about wildfires and air quality, supported children through our asthma summer camp, and helped fight COVID. We have also made sure that seniors get the resources they need, like breathing exercise, health screening, and education.
So I know some of the changes that have been made in Washington will affect our health, but do you have a message about seeing doctors?
Yes. The most important thing I would like to tell that don't ignore if you have any breathing problem, if you have a cough that is not going away, if you have shortness of breath or wheezing, don't think it is just because of the smoking or old age. Many people wait too long to see a doctor, and COPD is often not found early, and there is no cure for COPD. But if you find it early, you can take medicine and make lifestyle changes to help you feel better and slow down the disease. There is a simple breathing test called spirometry. Ask your doctor about it if you have any breathing problem.
So I can't overemphasize going to see doctors. Maybe a little bit of that is because my brother is a doctor in Merced. But my dad had prostate cancer. They pronounced him cured. And about 15 years later, he was starting to feel similar symptoms, but he was scared that it was going to be cancer. And he didn't want to go in because he was worried about it. And that just is the wrong thing to do. You need to
Yes,
go in when you're feeling those
exactly. You
symptoms.
have to go early so that you can protect your disease early.
Yeah. And my brother, who's a doctor, about a year ago, he had a fall, and he's pretty old, 78. And he knew that he'd been having symptoms of other physical problems, but wanted just to keep working and didn't think they were significant. And after the fall, they kept him in the hospital for several months to try to cure the other diseases that or symptoms that he developed. So he ended up spending a lot more time at home and um, looked like after 6 months that you were trying to figure out how he was still alive. Hope he doesn't look at this. Uh, so I can't overemphasize how important it is to
Yes,
get in and see your doctors and know what's happening.
exactly.
So we're pretty close to out of time. You want to summarize your message for everybody?
Yes. So I just wanted to say again that we are really proud to celebrate World CPD Day every year with Santa Clara Family Health Plan. And this year, I want to remind you again that our event is on Wednesday, November 19 from 11:30 a.m. to 1:30 p.m. on Zoom. People from all over the world will join us, and our audience includes COPD patients, caregivers, doctors, nurse, and students who want to work in healthcare. So please join us on November 19. Yeah, that they will celebrate World COPD Day.
And it's free medical advice, so take advantage of it while you can.
Exactly.
So,
Yes.
Sharmin, thank you very much for your work and the work of Breathe California. And we look forward to hearing from you in the future on other shows here.
Sure. Thank you so much, Teddy. Yeah, really nice to have you.
Good night.
Yeah, good night.